describing is conjunctivitis, and it has been called red eye and pink eye because the eyes look red or they look pink. And conjunctivitis or red eye is really an inflammation of the eye, and it could be due to several things: bacteria, viruses. Some people have allergies and their eyes get red, or an irritant. You might be exposed to a chemical. Some people, if they stay in a pool for too long with chlorine, that can also. But in this case, well, I should start off by saying we do monitor conjunctivitis on a weekly basis in Antigua. There are a number of diseases that we collect data and information on, and conjunctivitis is one of those. We collect data from Mount St. John Medical Center and from our district clinics. And we would collect from time to time. We would see maybe on average 1, 2, 3 cases of conjunctivitis. So it's normal. I mean, people would go to the clinic because of somebody might have picked up a virus, or it might have been and as I said, it could be an allergy, it could be, so that would be listed as conjunctivitis. What we're seeing now is an increase in the number of cases of conjunctivitis over the last few weeks. Up to 20, 30, 40, it's been rising per week as compared to the baseline figure of about 4 or 5. That's what we would call an outbreak, an increase in the normal that we see on a day-to-day basis. So we have been seeing that, and what persons have been experiencing, it's a viral conjunctivitis. I should say that over the years, from time to time, every year, we would see an increase in the number of cases of conjunctivitis, particularly after sailing week, and sometimes after the carnival season, we would see some. A number of visitors coming in, so they would bring viruses with them, along with their money and everything else that they come. Unfortunately, they bring other things with them. So conjunctivitis, we believe, is viral in this case. Persons would have been experiencing redness of the eyes, runny eyes, painful eyes, itchy eyes, photophobia. When they go out in sunlight or when exposed to bright lights, they get pain. Treatment is basically symptomatic. What is key, very critical in controlling or preventing conjunctivitis at this time is hand washing and proper hygiene. So now, it's a virus, as I said, more than likely. So what would happen is that, say a person has conjunctivitis, they touch their eyes, and then they go touch somebody else's eyes, they touch an object, and that person touches that object as well, and they touch their eyes, they will also get it. If I use a bath towel or face towel that somebody would, and I have conjunctivitis, and then somebody comes and use that, they might get it. So control is easy, but still a challenge for some persons. First thing, you have to wash your hands regularly, because if you do have pink eye or conjunctivitis and you touch your eyes and you wash your hands right after, you'll be getting rid of the virus. If it is that you wash your hands before you have to put in your contact lenses or you put on your makeup, you'll be washing any virus that might be on your hands before touching your eyes, so preventing the transmission of the disease. If you don't share towels with somebody, whether or not you think that person may have conjunctivitis, it's always good for each person to have their own personal material, like towels, face towels. Don't share makeup, sanitize objects around you, because the virus could, if I have a conjunctivitis and I touch an object and then you touch it, you can get it as well. So if the area is sanitized, it will reduce the risk of transmitting the disease from me to you through that object. Yeah, epidemics sound serious and people get very alarmed. And there are different types of epidemics. I mean, an epidemic in terms of public health means that there's an increase in the number of cases that we would have usually seen. And that's what's happening. We are seeing an increase in the number of cases that we usually see. So it is an epidemic. It is serious because it causes discomfort to the person, the pain, the photophobia, the itching, the watery eyes. So it causes discomfort to persons. It causes persons to miss work. So there would be a decrease in productivity. So of course it has an effect in Antigua on persons and the economics of the country. So yes, it is serious, and usually an outbreak such as this would span maybe about 2 to 3 weeks, and then what we call an epidemic curve. You will see an increase and then a decline. So we're monitoring it to make sure that we do get that decline. We're still on the increase, and I expect that it will peak. Well, I have gotten the reports for last week, and so far it's still on the decline, but I'm hoping that by next week we'll start to see a decline. Yeah, so it should not be a prolonged period, and that if persons do what we tell them to do, wash their hands regularly, practice good personal hygiene, we should see that decline soon. We would want to advise persons who have summer camps, if you notice that there are children who are coming to your camps who come with red eye or conjunctivitis, you'd advise the parents that they shouldn't come back until the redness has cleared up, the infection is gone. And so persons who have camps, they have to be vigilant. Check the children daily to see whether or not they have itchy eyes, whether they're complaining about their eyes, and if they are, and you think they may have conjunctivitis, call the parents, let them know, well, your child may have conjunctivitis. You may want to take the child to a clinic, but keep the child away from the other children at the camp for that period of time. In the work setting as well, if persons have conjunctivitis, they should not go to work and spread the virus to other persons. What can happen if persons continue to touch their eyes a lot, don't practice good hygiene, they can develop a secondary bacterial infection, which would need antibiotics. So if somebody has conjunctivitis and the symptoms are not getting better, the discharge from the eye becomes pussy, there's an increase in the amount of discharge, that person should definitely see a healthcare provider, more than likely an ophthalmologist, so that they can be prescribed antibiotics, because that person would have had a secondary bacterial infection and they would need antibiotics to treat that bacterial infection. I am concerned, of course I'm concerned, because it causes, as I said, discomfort to persons, and we are urging the public to wash their hands, good personal hygiene, and just monitor children, the elderly, camps as I mentioned, and we continue to look to watch it, and if that epidemic curve, if we don't start to see the decline, we have to take more serious measures. Doing maybe some more investigations to ensure that it is what we think it is, by just doing more public education to the people and urging them to not spread it, to be more vigilant with hand washing and isolating themselves when they do have the conjunctivitis.